So hello, everybody. I'm Dr. Vivien Brown. I'm a family doctor in Toronto, Ontario, and an assistant professor at the University of Toronto. And welcome once again to ResilienceRx. This is our platform talking to doctors, about doctors, thinking about how we can reduce our stress and really look at some of the issues around resilience, how we can learn from each other. You know, with the COVID pandemic causing a riskier workplace environment for everyone, I think it's more important than ever that we highlight mental health and the issues that some people are facing in terms of burnout. Today, I've got a really wonderful guest, and I'm excited to introduce her to you. Her name officially is Dr. Alexandra Manning, but we call her Ali. And Ali is a PGY 6 resident in psychiatry at Dalhousie University. In a month or two, she finishes her fellowship where she's done a specialty in adolescent and child psychiatry. And Ali is doing some very interesting work at Dalhousie. She's created and is participating in a Ballant group. I'm going to ask Ali to introduce to us all what exactly a Ballant group is, because it sounds amazing, and I wonder why we don't already know about this. So Ali, why don't you tell us what a Ballant group is?
Yeah, so Vivien, it's really nice to be here, and thank you for inviting me. Ballant groups have been around actually for quite a long time. They started over in the UK, and they've made their way over to North America, more popular in the US, but they've been coming up to Canada. And really the function of a Ballant group is for participants to engage in case-based discussions about challenging cases that they experience in their everyday practice.
And when you say challenging cases, is this an academic medical case? Is this an emotional case? Is this how to handle something? What is it exactly that you talk about?
Yeah, so another great point, Vivien. The challenging cases that we tackle in Ballant really aren't about diagnostically challenging cases or which medication we should choose to treat a particular symptom. It's really about exploring the feelings that come up and the relational aspects of the cases that we have. So it normalizes the human side of medicine, that we all have feelings and reactions to patients and their stories and their family members and the communities that they're a part of.
You know, it's interesting. I often talk to medical students and residents about the fact that they shouldn't go home worried about somebody. That if they're worried about somebody, it means they should be doing something. And whether that's ordering a test or talking to a colleague or checking with a consultant, if you're going home and you're ruminating about somebody, there's something you should have done. Mm-hmm. And I think that sounds a little simplistic, but I think that we all have cases that we cannot get out of our head. You know, cases that we think about that we should have handled differently or talked to differently, or, you know, maybe should have done something sooner or later. And I think the idea of this Ballant group seems like a safe environment to talk about that.
Yeah, and that is really one of the most fundamental things of Ballant, that it is a safe space. It's a closed space. So these are groups between 8 and 12 physicians that meet regularly for a defined period of time. So they get to know each other over the period of the groups together. And that really helps, I think, to create a sense of safety where people can bring forward these emotions and reactions that we just normally don't talk about. It's not within the culture of medicine to typically talk about these sort of normal human reactions.
No, the culture of medicine is like that stiff upper lip and, you know, just get on with it and not to cry, you know, not to be emotional. Mm-hmm. So I think this is very interesting. How did you get involved with this?
Yeah, so I actually got involved as a resident. And as you know, I'm a psychiatry resident. And one of the things that came up in our own curriculum was, again, a resident concern or a resident idea was to have Ballant groups as part of our curriculum. They had seen that it was happening in other schools. And we didn't have anybody in our faculty who had the training to do it. And so I actually found a training opportunity and went down and got the training. And it's something that I just felt really passionate about. And so we've been doing it with our psychiatry residents at Dalhousie now for the past year. And we're also doing it with Doctors Nova Scotia, so with physicians across the entire province who get to connect that way. And also through our PHO, or our provincial MARDOCs, is doing it for physicians as well.
It sounds very interesting, and it sounds like it's a structure for supportive care. We talk about people needing social connectedness and needing support in their faculty, in their department, in their hospital group. But this sounds like it's sort of one step beyond that it's more formal and it's trained facilitators, and at the same time giving a level of care that's just so important.
Yeah.
I'm interested in the residents. Do you think that residents have had a really harder time in this pandemic? Do you think that they've been stretched more than normal residency, which is always difficult? Do you think it's really impacted residents in a significant way?
Yeah, I think that the pandemic has created a stressful environment for everybody. And I think that in part that's because of just the huge amount of uncertainty that came with this huge shift in our day-to-day life. And I think that you're right, residents are stretched thin. I think that they were kind of always stretched thin. But our medical system as a whole, I think, is stretched, right? Medical resources are stretched. Physicians in general are stretched. And I think that the pandemic really provided a spotlight on kind of bringing that forward. I think specifically for residents, though, residents aren't a homogeneous group, but I think that one thing that is true for all residents is that residency really is a transition time. And I think for many residents, there was a genuine concern of, am I going to be able to graduate on time? Am I going to be able to start that next step on time? And I think that, there was a whole cohort of residents that were impacted by exams being canceled. And the concern around that, will I be able to start my job? Will people allow me to work if I don't have my Royal College exams? And then also for residents in other stages of training, will I be able to collect the competencies and the observations I need to be able to move forward in my training? So I think that uncertainty certainly led to increased stress for residents.
It's interesting, Ali, in another interview, we talked about the fact that lack of control and uncertainty is so stressful. And I don't know if that's more so for physicians than people in other industries, other professions, maybe because we're a little bit obsessive compulsive to start with. That's how we got into medical school. But I think that lack of control and the uncertainty is very hard to live with.
Mm-hmm. Absolutely. And when you look at that demand control model of stress-related illness, that's what we know, that as you increase demand and you decrease a sense of control, then you're more at risk for stress-related illness. And the pandemic put both of those things in the direction we wouldn't hope for.
Right. So do you think your colleagues, thinking about the residents and the doctors that you work with, and I guess the psychiatrists as well, do you think that they have outlets to speak openly about their concerns? Is it different in Dalhousie than it is in Toronto or than it is on the West Coast? Like, how open are people to talking about their stress?
So, that's a difficult question for me to answer because I went to medical school at Dalhousie. I completed my residency at Dalhousie, and I'm doing my subspecialty training at Dalhousie. I think what I can say is that certainly that has been recognized as being important, that we want to support residents. I think we want to support all physicians in being well. And we know that well physicians are better at treating their patients, right?
Exactly.
I think that the culture of medicine is one that it's difficult to come forward and talk about those things. And I think that's changing. Like, I see early signs of that shifting. I hope that it's early signs that things are shifting and that will be a sustained shift. But certainly the culture of medicine is one where it's not talked about. It's not safe to talk about it.
But you seem optimistic.
I am optimistic.
So what kinds of changes are you seeing?
So specifically within Dalhousie, these Ballant groups, I think, are a really great example of the systemic interventions that can actually be put in place to help support physicians in looking at relational issues with the patients that they treat. Like, we all have habitual ways in which we interact with patients. And it impacts how we feel about our job, our sense of satisfaction that we have with our job. And I think Ballant provides the opportunity to really explore that in a non-judgmental way. One of the things that we know about Ballant is that it actually helps to build empathy. And we know that building empathy, it can help to mitigate burnout. And so again, it's just an example of one of those structural systemic things that people can put in place.
I can see why Dalhousie won't let you go. I wanted to ask you a personal question. So you're not obliged to answer this if you don't feel comfortable. Yeah. But I wonder how you personally have experienced stress, anxiety, or depression in your residency, and how did you cope with that? What steps did you take to build your own resilience?
Yeah, so I think that's another great question, Vivien. And I just would like to start by saying, I think all physicians are resilient. I think that the system really demands for resilience in physicians and selects for resilience in physicians. Like, I think we can all reflect back and think about how we got into medical school, how we got through medical school, how we survived residency. Like, I was just at a physician wellness conference and they were talking about surviving residency. And I thought that's such an interesting way to talk about it. And yet It is the way we tend to talk about it, that it's something that you survive. And so I think stress is part of that. For me personally, I can share with you that I was one of the PGY5 residents who was ready to transition to discipline, who was studying for my Royal College exam. And 10 days before I was supposed to write, it was canceled. And so the uncertainty around that, the lack of control around that, not knowing what was going to happen, certainly was it was a very stressful experience in my life.
For sure, you've put so many years into that focus, and having that shifted unexpectedly with no control, I think would be very difficult.
Yeah, I think it was, it definitely made you think about how you support, like, how do you actually nurture the parts of yourself to maintain wellness despite all of those things that are going on around you that you don't have control over. And so for me, it was drawing on my support networks. Like, I'm fortunate that I have a good support network around me, both personally and professionally. And also, trying to reframe the fact that, you're spending more time, the routines that you had in place to support your wellness before were disrupted, right, for everybody. And so trying to think about, well, maybe this is an opportunity to re-engage in some of the pastimes I used to enjoy kind of before medical school kind of took over.
Mm-hmm. No, we hear about people learning how to bake bread and
exactly.
do all those things that they're sort of not necessarily expert at. This past weekend, I had to go into the office to see a patient because she needed a pre-op for Monday unexpectedly because her surgery wasn't canceled and she had to have it. And as a thank you, she brought me this homemade sourdough bread. And what she said is, in the last year, one thing she's done is she's like mastered sourdough bread. Yeah. And I thought it was just so interesting because people are going back to hobbies and music and certain things that they've liked in their past, even if they've been too busy to do that, except because of COVID now, they've got that opportunity. So I like the way you've used the term reframing, where it's, instead of just complaining or being sad about what you're not being able to do, reframing to look at what you are able to do.
Exactly. Yeah. When you can't control the things around you, one thing you can control is how you look at it and how you approach it.
Right. I see your optimism come through just in how you discuss even your stress. Mm-hmm. And I can see that you would be a very supportive colleague to other colleagues.
Oh, thank you.
But how do you ask for support for yourself? Like, how do you go forward when you feel you need something?
I tend to be quite direct when I need support, particularly in my professional world and my personal life as well. But I think it's more like it's easy to do it in your personal life if you have a sort of a culture where that's acceptable and sort of normal to do. In the culture of medicine, as we've talked about, it's sometimes difficult. I'm fortunate in that I have good mentors, I have good mentoring relationships. And I think having those safe spaces where you can go and ask for support and ask for feedback is really important. And I try not to be secretive about that. I think that one of the things that we can do is demonstrate that it's not dangerous to do this, that it is okay to ask for help. And particularly as a senior resident, and I was chief resident in our general psychiatry program as well. I think being able to say, hey, I can do, like, I do this too. There are aspects of residency that I have found challenging as well. And I don't judge any of you for having a challenging experience in residency either.
And I think that's so important because you do look to your mentors, but other people are looking to you as a mentor. Mm-hmm. And I think that'll continue throughout your whole academic life. Mm-hmm. Tell me a little bit about what you think would be good recommendations for health policies, either at Dalhousie itself, or if we're thinking broader for the CMA, Canadian Medical Association, or Health Canada. What do you think would be important policies for us, the collective physicians, to work towards so that we increase resilience and decrease burnout in our colleagues?
That's a really challenging question. To me, policy does not drive culture. And so I think it's often the other way around. And so I think what we do know is that many of the challenges that we have related to wellness and within sort of our colleagues are really systemic and cultural issues within medicine, and how the culture conceptualizes and addresses burnout and wellness. And so I think that before we can affect the change, we need to say it's okay to be able to be burnt out, or to not be well, or to not be as well as you'd like to be. And so I think initiatives like the rounds are a really exciting one because it offers the space to bring about a cultural shift. And I think that's really what we're all, I think that we're ready for it now. That's why I think I feel optimistic about it, because I do have a sense that we're ready to talk about that.
I think that that's really true. And I like the way you phrased it, changing the culture in order to affect policy rather than trying to go top down with policy to affect culture, which probably would not happen successfully.
Yeah. I think it would be tough to enact the policy if there wasn't the buy-in.
Mm-hmm. Yeah. It's interesting when pilots make an error, the culture of pilots is to discuss every detail of that error, to go over it in detail with everybody so that that error is basically understood so that it doesn't happen again. Yeah. I think with physicians, our general nature is to keep it private, not discuss it, and certainly not discuss our feelings about a loss or an error or a difficulty. So I think the whole culture is really very different. Mm-hmm. I'm glad you framed it the way you did, Ali, because I think that's really important. If you could make a change for residents, for medical students, what would be something that you would suggest from the get-go so that people starting medical school already would see things a little bit differently? Would it be these balance groups? Would that be part of medical school?
So yes, I would say that it is a great, I think that balance groups have a lot of potential to help support physicians at all stages of training. When you're working with patients, there are relational factors that come into play, and there are feelings that come with that. And I think that normalizing that and creating a safe space and a consistent demonstration that it's not dangerous to talk about these things. In fact, it's quite normal to have them would be a great first step.
Right.
Or an additional step, because I know it's not the first step.
Right. I mean, we're always taught to treat all patients in a similar way.
Mm-hmm.
And what I tell people is we may treat everybody in a very similar way, but that doesn't mean we don't feel differently about one patient or another, or one situation or another.
Yeah. And it's highly individual. Like, people will react differently to different cases. And I think that's, and again, one of the benefits of the Balance group is that you both see how things can be different, but also how things are the same between physicians and our reactions.
Right. So, Ali, what do you do for fun? What do you do just to relax when you're not studying for exams and you're not getting ready to start a new career as an adolescent and child psychiatrist? Like, what do you like to do?
What do I like to do? So I'll tell you, I'm pretty busy right now because, you know, my exam was delayed and then we had to do job applications, and now I'm studying for my next exam. But in between, I really enjoy spending time outside. I love cooking. So I don't bake bread. I didn't take that up during the pandemic, but I do love to cook. And I've rediscovered some old recipe books that I've enjoyed. And those types of things.
I like to cook as well because I find it's one of those creative things that I could do and see the outcome, right? Yeah. I don't have the patience to wait a long time. I want to see the outcome that day.
Yeah. And baking's too specific. You have to have everything just right. With cooking, you can be more.
You know, baking is chemistry, and that's not my forte.
No.
I like cooking better than baking as well. And I have to ask you, because one of the things that I really like, believe it or not, is watching U.S. football. You're not related to Peyton Manning, are you?
I'm not, but you would be shocked by how many times I get that question.
I'm not, because he was very popular, and it's not that common a name. And it's interesting. It's interesting. Ali, what have I left out about you that we should know in terms of resilience? What would you like to share with us?
I think the only other thing I would like to share is, when you ask the question about policy and what I would change for medical students, I do think that one of the things that I notice in like the curriculum initiatives that are coming out, and I think that they have great curriculum initiatives that are coming out, but one of the things that always worries me somewhat is that, are we also looking at the systemic and cultural factors? And I think looking at the factors that drive burnout and thinking creatively, like, I think that right now we need some like adaptive change. We need creative people to come in and say, how can we actually try to look at these drivers of burnout? And is there any way that we can help to mitigate that would be helpful?
I think that's really interesting. And I think we need people like you who are academically sound, but also emotionally connected to be part of that process. Mm-hmm. Ali, thank you so much for being with me today. And thank you for sharing your insights on ResilienceRx. You know, I think that this platform is unusual in that we are giving physicians a chance in a very safe environment to hear about different aspects from different people in terms of resilience and burnout and some of the choices that they make. And I think the work you're doing in this Balance group is just so very interesting. I really appreciate you sharing that with us. So thank you so much.
Thanks. It was a pleasure.